singing, crying, and even flirting are just a flavor of what some patients do under anesthesia. Some patients crack really inappropriate jokes. Some fight to get up in the middle of surgery and walk out of the operating room. And others spill secrets they've supposedly never told anyone before. It's because anesthesia is kind of like a truth serum in some ways. I'm Dr. Anthony Cave, and I've managed over 10,000 anesthetics, and I've seen people say and do things wilder than I ever thought possible. You're going to learn a lot about your brain under anesthesia in the next few minutes, so be sure to share what you've learned with your loved ones so that you can help them feel less scared of embarrassing themselves under anesthesia. I'm going to share the 3 types of patients and what they say before surgery so you can see which one you are. Then I'll share some real-life examples of what patients have said and done here in surgery and what you can do to help minimize the chance of doing embarrassing things, including with cutting-edge techniques like with virtual reality. And the most important thing that most patients don't know is that when fast neurochemical changes happen to the brain, bad things can happen. Like when addictive substances overwhelm the anti-addiction centers of your brain. Think cocaine or Xanax, for example. Well, the same thing happens to the anti-anxiety parts of your brain with anesthesia. Once you get anesthesia, different personality types begin to emerge. I've found 3 basic personality types that come up, and they're not always correlated with your personality before you went to sleep. As I go through them, think about which one you are. And for the record, this isn't a scientific experiment, it's just my observation over 10,000 plus anesthetics. I call the first group activators. They have a wound up central nervous system, and they'll try to control any situation emotionally or physically. The classic is the million questions patient. They will ask you every question, no matter how big or small, and even ignore social norms sometimes. I call it an intellectual survival mode. Look, I'm cool with you asking about what's going on with your body. I encourage that. But asking me how I met my wife or what I think about the President of the United States is totally not relevant to surgery. Same with asking me if I'm happy in my marriage or if I want to have a drink after surgery. It can be hard to redirect these folks. Sometimes I'll ask them an important health question, but they'll get distracted and go on a tangent out of anxiety. Now, it's super important to be respectful to your patients, no question. But if your doctor is asking you what medications you're allergic to, you shouldn't go on a rant about how your 27-year-old boyfriend was really mean to you after you said you didn't like his cooking. There's usually a psychological reason for why these bubble up in stressful situations, but it's important to navigate these safely before the life or death experience in surgery. Some of these million questions patients still talk or mumble even under sedation. It's like they're talking to themselves with a random stream of consciousness, often with a lot of mumbling that no one really understands. It's like their brain is go, 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 even if it's nonsensical. When surgery is over, they begin to speak louder, but it still doesn't make sense all the time. Like a 50-year-old man I had who really wanted to share the Hansel and Gretel story, but kept looping over and over again on the breadcrumbs part. Another flavor of these activators are what I call the silent sufferers. They actually look super calm on the outside, but they are white-knuckling it like no other. They are more of a covert physical survival mode. They may not ask many questions, and they usually answer with short yes or no responses. But it's a mistake to think that they're not hyperactivated or hyper-aroused. I usually don't appreciate just how tense they are until I give them the first bit of anesthesia and they begin to relax. Our life support monitors, especially the pulse ox, don't always give good readings because they're so tense and tight. The silent sufferers are typically so hyper-aroused and hyperactivated that once they get the anesthesia, they kind of burn out and get really quiet. Their heart rate and blood pressure are usually really high on the monitors here, but once they get the anesthesia, they tend to crash quite low. They're usually pretty quiet under sedation in surgery, but their bodies can get very tense very fast if something triggers them, like a loud sound or even light pressure on their skin. Then there's the trigger-happy patients. They're hyper-alert, ready to flinch or flee at any sound or touch. They're also in that hypervigilant state. They may not talk much, but they'll jump at the slightest sound of an instrument or anything else in the operating room, or even when something touches them, like the blood pressure cuff inflating on their arm. They're like a combination of the million questions and the silent sufferer. I call the next group the the avoiders. They love distractions and will go to any length to avoid facing the reality, even if it's looking them right in the eyes. Avoiders come in different flavors: the frat boys and the deserters. The frat boys are usually young men, but not always, and they like to joke or even argue with me until the very end. They do the classic fighting the anesthesia, even though they never win. They might act like bros at baseline, and then they get even more broy with me to secretly distract from the fear of losing control here in surgery. Some like to push buttons and challenge the environment. Some of them say socially unacceptable things like racist jokes, or make unsavory comments about how some folks look. They can make the staff feel uncomfortable, especially if they get catty. I'm sorry, but I can't repeat some of their comments because it can get really off color, but you get the idea. They may not be mean people at baseline, but the anesthesia disinhibition or that truth serum brings out their social defiance in unusual ways. Another flavor of avoiders are who I call the deserters. They'll cancel their surgery at the last minute because they're overwhelmed by the fear of the unknown. They also take a very long time in the bathroom before coming into the operating room. Young kids in particular are the most likely to actually run out of the operating room. It's heartbreaking to watch, but I've always wondered what happens to a kid who's running through the hospital in a gown with an IV in place. It's not like anyone's gonna let a kid go down the elevator and drive away. The last group are called the acceptors. They are rare. They control their body without needing to control their environment. I call these folks the Jedi Masters. They're probably about 5% of all my patients, and they accept uncertainty with curiosity. Their brain and authentic self are in alignment, and they don't feel any need to overcompensate with maladaptive coping mechanisms, physical or emotional. They are often calm, collected, and grateful before going under, and they tend to wake up that way. These aren't the folks who are embarrassed about what they may have said. So which one are you? Let me know in the comments below. And before I give you more real-life examples, hit that like button and share what you've learned with others. And subscribe to keep up with more of my behind-the-scenes medical videos. Now let's talk some more real examples. First is the classic disinhibition with anesthesia. I had a 24-year-old woman once on the table who got her first dose of sedation, and she looked up in my eyes and said, "You know, you're actually really attractive." How should a doctor respond? I gave her her oxygen mask and asked her to take big, deep breaths. But unfortunately, that didn't work because she just pushed the mask aside and asked me what I wanted to do after work. A classic and harmless example of anesthetic disinhibition. The patient says exactly what crosses their mind as social filters vanish. Propofol and benzodiazepines suppress inhibitory GABA circuits, leaving only unfiltered thoughts. And within seconds, many forget that it ever happened. Rarely does a patient remember these comments when they wake up. Some are apologetic, but some ask even more aggressively. A young man once told me something pretty scary before falling asleep. He took a big breath, his eyes got really wide, and he said, "Wait, am I dying?" Everyone falls asleep a little differently. But as the anesthesia starts, some patients panic for a brief second before the medications take full effect. Another patient once yelled, "Wait, I can't breathe," and then they were out cold 2 seconds later. They don't tend to remember these as near-death experiences, but from the outside, it certainly looks that way. It's the body's primitive survival circuitry firing, the amygdala's last flare before consciousness shuts down. Even though the patient's oxygen and ventilation are perfect, the mind interprets the loss of control as danger. One of the most touching things a patient told me, and the whole surgery team, was, "Thank you everybody for keeping me safe and answering my questions. I want you all to know how grateful I am for." And then they trailed off asleep. What's special about people expressing gratitude before they fall asleep is that they tend to do the same when they wake up, and they appear more well-adjusted. For what it's worth, in my observations, patients falling asleep with more gratitude tend to wake up with less pain and less anxiety and less emergence delirium. They're less likely to decompensate. It's not always true, but there's certainly a trend. Another patient once called us his angels and said, "Don't let anything bad happen to me while I'm asleep." Same story, they also woke up calm and collected. It's like a real raw vulnerability, and it's the purest form of trust I've ever seen in medicine. Some of these deserters can be really dramatic. I once had a buff middle-aged man on the table here suddenly yell out of nowhere, "Get me out of here!" Kind of like the Hulk. He then grabbed my hand away from his mask, and it got really tense really fast, but luckily for me, within 2 seconds the anesthesia reached his brain and he suddenly relaxed. If he hadn't relaxed though, I'd have to negotiate and de-escalate the situation with the staff, which is never easy before surgery. Rarely, a patient might jump up after a loud sound occurs in surgery, and we need to work to calm them down either with medications or verbally so that we can safely continue the surgery. Remember those activators I mentioned earlier who are hypervigilant and are quick to hyperarousal? One of the hardest things to hear as an anesthesiologist as you're helping someone go to sleep is a patient with tears in their eyes saying, "Tell my kids I love them," just in case. It really shows how some folks can get really emotional. It's not melodramatic, it's like existential clarity. What really matters most bubbles up in those moments right before they fall asleep. No one has ever asked me about how to distribute their 401k if they don't make it. It really shows what folks prioritize. So what can you do before surgery to minimize a chance of blurting out something embarrassing or acting out once the anesthesia kicks in? We have a saying in surgery that patients wake up the way that they fell asleep. So if you fall asleep really anxious, blurting things out, you might wake up similarly. Can you do anything about it? The most common thing is to reduce anxiety by wiping out their memories with powerful medications like benzodiazepines. Midazolam or Versed are the most common before surgery. At least that way you won't remember what you said either. Less anxiety leads to fewer embarrassing comments because folks aren't in survival mode as much. They're less likely to be super tense, physically or emotionally. It makes them more like the Jedi Masters. Fortunately, there are other ways of reducing anxiety without the sledgehammer of medications. Some include virtual reality or augmented reality to lower our anxiety levels, music therapy, or even essential oils. And my favorite, gratitude practice. Gratitude practice is my favorite because I found that patients who express gratitude are so much less likely to blurt things out or to be rude. I have many videos on how to reduce anxiety before surgery. Be sure to check them out, linked in the description below. Just this week as I'm recording this, I had 2 patients who fell asleep with so much gratitude and woke up thanking the whole OR here in the operating room. Not a single outburst or racist joke. Just cool, calm, and collected. So who would you be under anesthesia? What do you think you would say? Would you be a frat boy or a million questions? Let me know in the comments below and hit that like button and share what you learned with your loved ones. And subscribe to keep up with all of my behind the scenes medical content. And remember, you have more power over your health than you've probably ever been told. To learn more about my approach to medicine, visit my San Francisco clinic's website at www.claris-health.com.